Hey everybody, it's Dave Juno, the Meniere's Disease Warrior. How you all doing? I'm doing pretty good. It's been a good day today. I didn't do much, just kind of hung around. Um, I did some things in the house, and it's probably a good thing too that I did that because, as everybody knows, or I've talked about, I should say, I'm scheduled to have sac decompression surgery on June 6th. Well, that's been changed. It's changed to May 16th, this Friday. So in 3 days is when that surgery is going to happen now. And I'm very excited about it. And the reason why I am is because, I have been having a lot of attacks lately, um, a lot of instability, a lot of things like that. And the decompression, I'm hoping, will help that, at least for a while. So I can get back to living even more than what I already do. Because, see, I had a laparoscopy done in 2019 on my left ear. Okay, so I can't have another one here because then I'll have it absolutely no balance. So they're going to go in, they're going to shave the bone down and everything. And if she feels the need to put a shunt in there, then they'll do it. If she doesn't and thinks it'll be okay, because I'm sure they'll have to redo that again in a few 5 or 6 years, then we'll go from there. Okay. And I know there's risks. There's always risks with any surgery. She could nick the nerve by accident or something, and I could have facial paralysis or end up being deaf. Totally. But you know what? Cross that bridge when we get there. Right now, I'm excited to know that there's probably going to be some relief from the vertigo, and I'll be able to do more. You know, I don't know if I'll be able to go back to work, but I'll be able to do more than what I already do, and that's pretty good for me. I'm really excited about it. And I've also heard a lot of good things about this surgery too. So I get that going for me as well because I listen to people, I listen to things. Um, but they can't do another laparoscopy, and I had good luck with it. It probably took about a year to heal from the laparoscopy, meaning the vertigo to totally stop. I was still getting residuals, nothing like I had in from 2014 to 2019. So it was nothing like that. But it slowed down and everything until probably about 2020. And then I went 2020, 2021, 2022 without any vertigo. 2023 was like near the end of it. It started getting small vertigo attacks. 2024 is when they diagnosed, when they diagnosed me because I was getting a ton of vertigo attacks as being bilateral, for those who don't know it. So I'm excited. I'm confident in the doctor. She's done plenty of these surgeries. She knows what she's doing. Um, she's also, a Vita director and everything. So I'm pretty really excited. Be surprised. You think I'd be like petrified, but then when I had the laparoscopy done, I was excited. And the reason why I'm excited is because I know now there's a path where the vertigo is probably hopefully going to stop. Now, I'm not telling people you should go find a surgeon and get this done. The decompression, I haven't had it yet. So there'll be more videos about it as we go on. And I'm going to post a picture with this so you can see like where that sac is and where they're going to be decompressing. It's not going to be, a human picture, but it's a drawing and you'll see exactly where it is. But I'm not saying that it's for everybody. Okay. I tried a lot of different things before, I went to the surgical route. Okay. The low salt diet, I've always been doing that since, God, 2010. That's why, everybody talks about low salt and they get panicky. It's like, I've been doing this forever. It's, if you stay like 1,500 milligrams a day, you're usually pretty good. Um, and, I still have my Diet Coke once in a while or, you know, um, Diet Coke once in a while or Coke Zero. I like Coke Zero a lot better. Once in a while, not every day. I mean, I used to drink it all the time. That could escalate it. But if you look at the can, it's 35 milligrams. It's not, you know, you're not drinking 200 milligrams of sodium. unless you're using those energy drinks. Those things can be loaded with sodium. Um, but I've been doing that for a long time. So yeah, I went that route. I still do that route. I do. I will say this: I do. I do eat a lot of meat and fish and chicken. Probably more chicken than anything. And it's not because of the carnivore diet lady, my friend Allie. I've been doing that for a while since I had diabetes, and that did seem to help a little bit. I'm not gonna say it cured me or got rid of it. It didn't, but it does help. Um, and the diet thing and the gentamicin shots. Before I had the surgery here, I had actually 2 steroid shots in this ear, 5 gentamicin shots. None of them worked. Steroids helped a little bit, but the gentamicin never did. I've also done 4 steroids in this ear, and it helps for a couple of months, and then I'm back to it again, you know, and back to having to get another one, and $3,000 for those shots. I mean, I'm not paying it. My insurance is paying for it, but for me and everybody's different. Those shots kind of hurt a little bit. They don't hurt when they're doing it. It's afterwards. So I did try these things before I said, okay, let's do this. So yeah, they changed the date. I guess I didn't realize I was on a waiting list. I guess my doctor wanted it done as soon as we could. And she put me on a waiting list. I just didn't realize. I think she probably told me. I just probably didn't realize it. So yeah, I'm looking forward to it, and I'll be making more videos as they go along. See how you're doing. I might make one like the day after the surgery, and I'll probably be out of it. So excuse me. And I know I'll probably have to have a cup on my ear. I mean, literally, when you have these surgeries, right? I had it on this ear. The thing looks like a cup that you would wear playing sports, and it's on your ear. Okay, I'll probably put one on this ear. Um, so yeah, I might make like a short video or something, but this time around, I'm not going to be in the hospital, which is a good thing. Labyrinectomy, I was in the hospital for about 4 days. They did tell me it was a day surgery, but then they ended up keeping me for 4 days. Um, I and they never told me why, you know. They just kept saying, "Oh, I was a fall risk. I was a fall risk." I'm like, okay. So I stayed in for 4 days. I stayed until I could walk without the walker. Walk a little bit without the walker, which was fine. And then, so this one, I'm going to be home in a couple hours after they're done. Now surgery's like an hour and a half, 2 hours, and they'll be done. When they're done, about an hour or two after that. So we'll go from there. And hopefully there's not a lot of pain. If there is, I'm sure they'll give me something, and I'll probably take it one day and say, "This sucks, give me Advil." But on that note, I want to let people know what's going on because I just don't want to be posting in everybody's group and messaging my Meniere's friends. This way, everybody knows what's going on, and I'll let you know more. So yeah, I'm very excited. I can't wait. Um, my wife. I think my wife's more excited than I am. She hates looking at me suffer, and that's a good thing. I don't like my wife looking at me suffer like oh, this poor guy. you know. So hopefully, I'm gonna get some relief, be able to get rid of the vertigo and or minimize it at least, and get back to being somewhat normal. Not I'll never be normal again. Well, I've never been normal to begin with, but I'll have another new normal, basically. So that's it. Hope you guys are all having a great time, great day, and you spin free, um, and I'll keep you updated on my adventures. And that's it. And take care.